Welcome to Observations, an open conversation about women's health. This is a space where physicians, patients, and other experts can sit down and have honest, evidence-based dialogue that cuts through the media bias and brings clarity back to maternal care and how we can care for both patients, mother and preborn child. With each episode, we will have real stories, real science, but also real questions about women's health today. From clinical insights to lived experiences, to aligned perspectives, and yes, also respectful disagreements. This is our goal, to bridge the gap between physician and patient, to empower informed decision-making, and bring back and elevate compassionate, fact-driven care. Now, a quick note before we dive in. Not every guest on the podcast is going to represent the views or positions of Applog, but we believe that having open and honest conversations are going to make us better. So, grab your coffee, settle in, and let's get into today's observation.
So today we are joined by Alex Fisher, a medical student at a public state-funded medical school and a member of the U.S. Navy Reserves. As a disclaimer, Alex Fisher's views do not reflect the view of the United States Navy or the Department of War. So Alex and I first connected as he was a first-year medical student, and they were getting ready to have lectures related to women's health, particularly abortion. And Alex is a member of the Christian Medical Dental Association. And he and some of his classmates wanted to talk a little bit about the topics of women's health and abortion prior to their lecture and their discussions. And so his CMDA representative connected us, and we have really enjoyed getting to know each other. And I invited Alex to participate in our podcast because as a medical student, particularly one who just finished his first year of medical school, I thought it would be really important for him to be able to share his experience in medical school, as well as some of the questions that are swimming around as he's thinking about things from what is the role of abortion in healthcare? What about conscience rights? Things like autonomy with patient care. And so we are delighted to have you here today, and we want to welcome you and thank you for joining me on Observations.
Well, thank you so much for this opportunity, and just so encouraged that this organization exists, and that there are people fighting for this opportunity, and just ready to have this really good conversation, and hopefully we can encourage some other people in medical school or in residency to also kind of talk more about their education and their experience through their early years and throughout their residency experience in medical education.
Well, so speaking of education, Alex, what led you to apply to med school and want to be a doctor?
Yeah, I actually grew up in a smaller town, and was the only child of two first responders. So my mom is a paramedic, and my dad is in law enforcement. And so I think both of those careers gave me a really unique perspective on the world growing up, and led me into kind of wanting to do a career where I could serve others and make a similar sacrifice as they did. It's actually interesting. I throughout middle school and high school, I really wanted to enlist in the Marine Corps. I thought the Marines were the coolest, baddest guys out there, and just really liked the honor that they always had, and just the standard that they held themselves to. But was doing really well in high school, and so decided to apply to college, and was always kind of interested in the healthcare field, just because I always was around my mom, who was a paramedic, and around the EMS spaces a lot. So I really enjoyed that, and always did well in the science and math classes. So my freshman year of college, kind of started to pursue medicine. And I was always a really competitive kid growing up, and I didn't want to. I really wanted to always just shoot for the stars if I was going to go into a career. So I picked medical school. I thought that was like the hardest thing you could do. So I picked it and I was like, I'm going to go do that. But had a lot of really good experiences in my undergraduate education in rural healthcare, and just really got me excited about going into medicine and serving more underserved, more rural population. And then as I got near the end of my undergraduate education, really reflected back on what what I wanted to do previously, which is serve in the military. And so I knew that there was a program out there that you could do both. So you could be a regular person that goes to medical school, but you can also be in the military and then serve after medical school. So got accepted to the health professions scholarship program through the Navy, and that is kind of where I'm at now. And so, been through my first year, and I've really just enjoyed all the experiences, and really have just become excited about providing care to patients in both the civilian and the military world.
Fantastic. Well, thank you for your service. So, speaking of experiences in your first year of med school, so it was in the 1990s when I was in your shoes. So, a little bit of time has gone by, but tell us about your first year of med school from the standpoint of what classes do you take? What's the structure of it?
Yeah, so we have at our school we have a systems-based approach to our education. So we basically go block by block and go through each system of the body, and we learn all the normal embryology, anatomy, physiology, and pathology for each body system. And we pretty much just start out the gate with basic musculoskeletal anatomy, physiology, and then move on to like cardiology and then pulmonology, and just go through each block. And so we've made it through, I think, about 5 or 6 systems now, and we have a couple more to finish up before we take our step one examination in January or February-ish. So we do about a year and a half of preclinical systems-based blocks, and that is our main education, along with the typical lecture style courses that we have. We also have some supplemental courses. So we have a more case-based learning course where we have smaller groups, so smaller groups of 8 to 10, and we go through a case that has to do with um, the system that we're learning, and we'll go through that case and kind of make some patient plans for them. And then we also have a more physical exam and patient care class where we learn more about how to take a physical, take a history on patients, and actually do the real doctor things. And then our final class that we do is our ethics course, which we'll probably talk a lot about this afternoon. But that is where we discuss, and it's supposed to be a open forum type ethics course where we're in groups of 8 to 10, and we can talk about really difficult ethical concerns and ethical problems in healthcare, and really get to the bottom of what we feel is the right way for us to move forward with that ethical concern. But as we'll talk about, like, that course has is a lot more biased than not. That's kind of the setup. We have mandatory classes, so we do have to be in class. A lot of medical schools are moving away from mandatory classes, which is a different discussion for a different day. But so we are in person 100% of the time, which has really helped us to form a good social atmosphere, social bond with our classmates. That's the setup for us.
Okay, that sounds like a great structure. So, as you entered this year, I know you had in your mind you were going to be learning an awful lot of content. And as you reflect on the year, is it what you expected? If so, in what ways? And then in what ways maybe were you surprised?
Yeah, I so coming in, I did know that medical school was going to be a lot. Everyone always says you're drinking by a fire hose with amount of information. I was kind of a little bit surprised that um, it was it wasn't as difficult as what a lot of people were saying. I feel like we have a lot of time, which is good to really integrate ourselves. We're not worried about other too many other things outside of just learning the information, which is so nice. I feel like in undergrad, you're trying to do so many things. You're trying to work a job and trying to get clinical hours and all of this thing. So it's been nice to just focus on school while we've been here. And so in that sense, I was kind of surprised. But as far as the education, I think that the systems-based approach that we take has been rather nice. It has been something that I've really enjoyed. I kind of wasn't sure if I would like that coming in because unlike a lot of medical schools, we don't do all of our normal anatomy, normal physiology up front. So we just learn all of the physiology, all the anatomy, all the pathology of each system at one time and don't really come back to it ever again. So coming in, I wasn't really sure if I would like that or not, but it actually fits me really well. And then I think the other big thing coming into school, I knew that just the area that we're in and the school itself, I kind of knew the mission of the school as well as I guess some of the biases that the school projects publicly. And so I think that those kind of things were shining through from the very first day. And we can talk more about that, this afternoon. But those biases were really, I mean, first day of class, first week of class, it was very clear kind of what our curriculum was going to be based around. And I think that it it wasn't surprising to me just knowing the school in its history, but it was it was kind of like a reality check whenever I first kind of got presented with that, and I was like, okay, we're in this. We I just have to kind of put up with this for the next couple of years, even though I don't necessarily believe in this. I've got to just keep on going so that I can get a good education.
All right, so you have teased us with the word bias a few times and showing kind of what the bias of the school was, and that you'd have to put up with some things. So give us some details. What do you mean by that? What happened that first day or week?
Yeah, so I think that, or I know that the first couple of weeks we had like 2 weeks of orientation, and then as well as early on, the first couple of weeks were kind of a slow progression into courses, and so not as much heavy content. And so uh, very early on, we got lectures on gender-affirming care and how we should go about that. And it was very clear that we were going to have a full curriculum throughout our 4 years here on the purpose of gender-affirming care, and that this was kind of the law of the land, and then that this was a fact, and that we should be supportive of all of these things. We had, I think it was the first or second week, we had an hour long lesson on um, the role of the non-binariness of gender and just the history of that. And so I think it was clear that first 2 weeks that okay, if we're going to be talking about this, what's going to keep on coming throughout the curriculum? And they presented it to us very early, like, hey, we are going to keep learning about this through all your different courses, and we're going to keep presenting this throughout your entire first year, throughout your second year, and I'm not sure how that's going to look for our third and fourth year for rotations, but that was definitely a big bias there of kind of setting that stage for this is what we are going to teach. This is what we are going to believe in at our school. And you either get on board with it or you don't. There hasn't been any necessarily consequences or any examinations on any of that type of education, but since again we are mandatory classes, we do have to go to it, so we can't elect to not go to these classes. And so throughout the year, things just started to get kind of worse and worse about certain topics. So
So I think one of the things that AppLog really cares deeply about is the education that next generation of doctors and medical students are receiving through residency and medical school, and particularly conscience protections. So your ability to object to various things that you're learning, or at minimum to be able to have open dialogue. So share with me, what's the culture in your school related to, it could be gender affirmation care, it could be abortion, it could be a non-women's health topic. What is the feel there with regards to the information presented?
yeah, I think it's kind of it's a difficult thing to grasp because there isn't any clear cut. If you say this, you're going to get in trouble. You're going to get your class is going to not like you. There isn't any clear cut rules on that. And our school is very big about, they want you to express your opinions and they want you to come in with an open mind. That's what they kept saying throughout the interview process, is that we're a very open school and that we accept all different types of opinions, all different types of people. Um, However, it does become difficult whenever, again, the people that are lecturing you, the people that are on faculty at the school, the people that are running your courses and that are, you know, doing your grades, are teaching you only one side of the story and are biased towards one side of the story. And so that, as someone who's learning, that makes you feel like, okay, this is what they think is the right way, and so I'm not gonna sit up there in a class of 230 people, because we have lectures with all 230 of us. Our class is a rather large class, and so if we sit up there and try to object in front of 230 people, and you have no idea what the opinions of your classmates are, and those are going to be your future colleagues as well, those people that you're sitting in class with. So that makes it a gray area as far as if a lecturer says something in a class of 230, can you object? Can you say that's not right? That literature is not right. That study is biased. Doesn't have the sample population isn't good. Can you say that? According to our university, you can, but it just is a gray area, and I think that a lot of us are scared, because we know that that can follow us. We know that if we say that in class, all 230 people are going to hear us, and those future colleagues of ours, and the future people that are going to be deciding on our residency, because a lot of those faculty members sit on the residency boards. We're all trying to compete for residency spots. So if we say something that maybe someone doesn't agree with, is that going to hurt us in the long run? And and honestly, we don't know. We're at the bottom of the food chain as far as medical education comes, especially being a first year and now a second year. We're just moving up the food chain as we get more education, but we're still pretty low, and we don't have a lot of uh, experience and a lot of credibility under our belts yet. So it's definitely a scary place, and I think that's kind of a good feel for how our class feels too.
Yeah, you use the term food chain, which basically is another way to say the hierarchy that exists in medical education. And a first year medical student then second, third, fourth, you've got your intern, then you have your residents, your fellows, and your attendings. And it's very militaristic in that way. And so it's really difficult to challenge or even just want to express a different opinion, much less be involved in your third or fourth year of residency in surgical procedures or prescribing drugs that you are not comfortable with doing. And I think that's where, conscience protections really matter. And, one of the um, things that's really different, you haven't experienced it yet, but I think it's important that our audience understand that when I trained in the 1990s, I could opt in, for example, as an OBGYN resident to do abortions, meaning if I wanted to learn to do induced abortions, I could do that. Now, as of 2018, residents have to opt out. So the expectation is that they will do them and they must tell that other resident or that attending, that fellow, I don't want to do that. And it's a really coercive environment, given the fact, as you stated, that the individuals you're having to opt out to are the ones who are determining whether you move forward in perhaps your residency or a clerkship situation. So, I think it's really important, and I appreciate that you're talking with us today about your experience. And your last thing that you said was that you think it's representative of a lot of the students. So would it be fair for me to say that it's difficult for students in your class to feel comfortable challenging the narrative that, for example, the narrative that started the year with gender affirmation care, and I imagine you're supposed to use the word people and not a woman if pregnant, and that type of thing.
Yeah, yeah. I mean, I think in general, our society has shifted a lot, especially my generation. We grew up with technology throughout most of our childhood, and so that the whole idea of even talking to someone face to face is difficult for a lot of our generation. And then on top of that, expressing an opinion that is different from someone else and are like basically arguing with someone and showing your side of the story is even more difficult. And so in general, I don't think our generation is as willing and desired to do that type of thing and to speak out. But on top of that, as you said, there is, that expectation that that they have placed on us that this is kind of how it works. Like you said before, you used to have to opt in for these things, and now you have to opt out. And so we had a classmate of ours say that abortion now is kind of um, an example, an analogy that they used was that a firefighter has to fight fires, and so as a doctor, you have to perform abortions, and so that was kind of the example that we were kind of given, and so now it's just the status quo that uh, that medicine is performing abortions, that medicine is doing gender affirming care. And so now to speak out is you feel like you're in the minority. However, I don't think that we are really in the minority. And I think that there is definitely a lot more people who have a more middle approach to that and are not one sided or the other. But it's just, again, really difficult for someone to speak their opinion with because they do have fear of the repercussions that they may get, whether that be not getting into residency program, whether that be being shunned by the rest of your classmates, or whether that just be down the road, not having good colleagues um, in the healthcare field because you express opinion that um, you know other people they don't agree with, and especially in the time of the cancel culture environment that we've had in the last 15 to 20 years, and we've grown up in that, we've seen it. where you have a lot of very important people and celebrities and political figures that will say something and they'll get canceled for it immediately for speaking out about what they believe. And I think that's another thing that has definitely our generation has seen, and so we just would rather avoid conflict at all costs and not really speak out about those things.
Well, I appreciate that you have chosen not to follow the crowd of not speaking out because, as Dr. Donna Harrison, our former CEO, has said, is that courage is contagious. And I had the very fortunate privilege of interviewing Dr. Robbie George, who was our keynote speaker at one of our evenings at MBEC, and he is a brilliant mind who loves to bring together dialogue and recognize that we can have dialogue. And when I made that statement when I was interviewing him, he said, "Courage is contagious, but so is cowardice." And it's so important that we speak up. And as you know, we even think about, you gave the example of a firefighter must fight a fire. So it sounds like you're being taught that an OBGYN must perform abortions because it's part of reproductive health care. And when I remember when we were having a conversation with some of the students that when that came up, talking about the fact of who decides abortion is part of reproductive health care. It's not a professional medical organization. It's not a particular school. You have to go back to look at the purpose of medicine. I mean, you could take all 230 of those students and look at the personal statements that you all wrote to get into medical school. And I can guarantee you the words healing, the words health are in those. There was not, I want to go to med school so I can intentionally in the life of patients. And as an OBGYN, as a family practice doctor, we take care of two patients, a mom and a baby. And since the purpose of medicine is health and healing, the direct and intentional killing of one of those patients it's not healthcare. It never has been and it never will be, though that's the narrative that so many in medical school are sharing with APLOG, that they're being told, even discouraged to go into OBGYN if they're not willing to do that. I had the really good fortune of being invited by the White House to be a witness this year for President Trump's Religious Liberty Commission. And I got to talk about conscious protections for those in training. And I think one of the most important messages that I hope any other medical student or resident who listens to this will understand is that you have protections and that you don't have to go against your conscience. And if that is, even if you're being taught at the beginning of life or the end of life, that the direct and intentional killing of one of our patients is healthcare, we get to push back on that, and we can't be forced to do that. And I know in my field, I'm not sure if this was one of your resources that you were given. We can talk about. You've mentioned the word bias about things that you were assigned to read, but I know the American College of OBGYN, for example, they have a committee opinion that's titled "The Limits of Conscientious Refusal in Reproductive Medicine." By chance, did you all get asked to read that?
Yeah, and yeah, that's we did, and it's one of the ethics class that I was talking about that we are required to go to every week. We part of that class is they give us assigned readings, and interesting enough, it was one of the readings that was assigned for us. And while that specific class was not intended to talk only about conscientious refusals, it was obviously a big topic, and so that entire class session for us, we ended up just talking only about that and that one paper. And just because it was such a big discussion piece, and particularly I had a lot of pushback and a lot of questions for the class to raise to see how people would respond and what people would do with that. But it was very interesting because before that class, I actually just was doing some research on that paper and saw Apolog actually had a response piece to that exact paper, and I just really was intrigued that there are other opinions out there, other literature out there that have other opinions, but our class only assigns us to read one opinion. And so I am not here to say one side or the other, but I would just love as someone who's going through medical education to see both sides. And so if we're going to be presented with a one side, it's an opinion piece. I mean, it is an opinion article and it says that. It's not like it's a randomized controlled trial with blood pressure medications and it's a clear cut, this drug does better than this drug. It is an opinion piece. And so why can't we see the other side? I think that would be so helpful for all of us because we're all so young in our medical education. We're also inexperienced. And so if in our first year of medical school, we're getting pushed this idea, how is that going to shift your perspective on medicine? I mean, a lot of us are coming straight out of undergrad or have done a couple of gap years and still haven't really figured out who we are. And so, if you're kind of getting us at this really unstable at a point in our medical career, it's really going to shape how we think about things. And yeah, so I mean, talk more about that conscious refusal paper. It was very interesting. And just what's your thoughts on that paper and how you guys responded to it?
Yeah. I think you bring a great point that one of the things Applog has been trying to do is just have debate, scientific, scholarly debate about this topic related to the role of induced abortion in healthcare. And unfortunately, the response we get from leaders uh, who believe that it is an essential component of healthcare will say this is settled science and that the research is settled. It's safe. There aren't any long term effects, even denying things like psychological impact on women when we know the literature, says otherwise. And so, as somebody who's an MD, PhD, and spent 6 years getting a master's and a PhD, one of the things that was solidly taught to me is to be humble about the scientific approach and that whatever findings we have, we need to replicate those. We need to have integrity in our research. And that while we may have an outcome that we're surprised with, doesn't agree with our hypothesis, maybe doesn't even agree with kind of, in these cases, what we believe, we need to actually accept the research and continue to build on it. And when a medical school only shows one side, because you've used the word bias and you've given us this specific example of here, they're not saying that they want to have that dialogue, and it's so disappointing because you're right, you're agreeing, you're just absorbing everything, and the one narrative that you're being presented is indeed biased. And if if you don't have a student that really wants to seek and understand, they may take for face value um, something that says there are no long-term harms with abortion, for example.
Right. And just to piggyback off that, I think that just seeing, you were talking about other biases that we've seen. Another great example is during we had an hour long course or hour long class on the safety of um, abortion and how it is healthcare. how it is safe for our patients to do. And it was actually funny enough, it was our very last class of the entire first year. So it was kind of a great way to end our first year. And in this class, again, they were bringing in literature. And I think as someone who really enjoys the research process and really enjoys going into the literature, it's so easy. I can go online and cherry pick different articles that are going to agree with my opinion, and that's what happened. And there was basically a list of like 4 or 5 different articles that they put up there. A couple of them, one was the Turnaway, or yeah, Turnaway study, I believe, that was supposedly a landmark trial that they did, where it showed that patients who were not, or who actually got abortions, were less likely to experience anxiety and depression and mental health crises. Um, but then when you actually go and look deeper into how they did their sample, 68% of the patients that they had tried to get opted to not even do, they didn't even want to do the trial. So they lost 68%. And then of the people that did after the first interview, another half of them dropped out, but they still published this article. And this article was presented as factual to us in class, and that this is what we agree on as a university, as a medical community. So again, I can go and cherry pick every study that I want to cherry pick, but if I don't present the other side, then I think that is just not good medicine, not good healthcare, not good for our education process. And so, my big request is, sure, present that article, but also present the 5 other articles that disagree with that, that the 5 other trials that show that that is not actually the case, that that patients that do have abortions do have a more likely chance to have mental health disorders after they have their abortion. Um, so present both sides, and then let us, as the people who are getting educated, decide, okay, what does the literature say and what am I going to side on? Because the 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 aspect of abortion and gender care is such a polarizing topic, and a lot of it is based off of what your morals are and what you think is important. Do you think autonomy is important? Do you think that the life of the patients are important? Do you believe that the baby is actually a human when it's in the mother's womb? You know, what you believe in your morals is such an important piece of it, and it's not something that you can reflect in a randomized control trial like you can with uh, blood pressure medications. So I think that having both sides is such an important process, and if you don't, then it really just invalidates your education and the educational process.
Kudos to you for diving deep into a slide that you looked at and kind of said, "I'm not going to take this on face value," um, and and researched it. That is exactly what we should be doing, and that's exactly what your faculty members should be providing for you in terms of your educational experience. So when you think about conscience protections, and I mentioned I was able to be on the Religious Liberty Commission as a witness in healthcare. Do you think your classmates understand that they have the right to conscientiously say no in situations that you all may be faced as you get more exposed to clinical? And I particularly ask that because I'm struck by the fact that your school chose to start the year with gender affirmation care and end the year, as you just said, your last lecture was abortion. They took two of the most polarizing areas of medicine and they bookmarked your year with those two.
Yeah, I think that also I didn't really think about that until you just said it. It's so difficult in school because you're just moving so fast and you're just going to the next thing, and then you look back on it and it's like that is interesting that the most polarizing things that we in society disagree on are the first and the last thing that we learn. So the things that before we go on break and the first thing that we do before we even start. That is an interesting thing. But as far as like if we know that we have the right to conscientious refusals, I I don't know that a lot of our classmates think about that. Maybe just think very deeply about things. I tend to think a couple steps ahead and just really enjoy looking at the depthness of that. But I think a lot of people probably are just looking at trying to get past the next exam, and they haven't really thought about that, which is I may be wrong about that, but it seems that not a lot of people talk about it, and that B, when you start talking about it, when we did have that lecture, we did have that ethics discussion on conscious refusals. Not a lot of people were kind of aware about what the state of that was, and I think that it was just unclear what what rights we do have, and it's kind of scary going into third year. And even for myself, I'm not 100% up to speed because they don't teach you. There's not a class on what you can and can't do in a patient room. There's not a class on the laws of healthcare and how you should act as a doctor. And so going into third and fourth year rotations, when we do get encountered with something that we feel morally against, like there isn't a lot of education on what we should do if we're allowed to say no, if we're allowed to stop. I have heard from some people in their third and fourth year rotations that our university does allow for them to, if they morally object, to step out of the room. But again, I think that it is definitely a taboo thing in the medical education world as a young third year who is trying to do well in their rotations. If you step out of the room for something that you morally object to, you probably know that your evaluations for that block, for that rotation, are not going to be as well as they could be. And we are all trying to get into residency programs and do as well as we can. So there's just not a lot of like education on what we can and can't do, which I think leads to a lot of us just not knowing and not really thinking about it until we get to our third year. And then by that time it's too late, because when you get to a point where you're having to make a choice, if you don't know what choice to make, then you're probably out of luck.
There are a lot of great medical organizations out there that support students, whether that's the CMDA or Catholic Medical Association. And of course, APLOG, we have a student subsection. And a lot of medical students think that they have to be going into OBGYN to be part of that, and they absolutely don't. We have a conference, our national conference called MBEC, and we have 60, 70, 80 students who are going into a wide variety of areas of medicine who find a home at APLOG. So I'd encourage any student or resident to join APLOG and know that you're going to have a network of people that can actually help you understand your rights. And I'm hopeful that, when you're in a second year student, you're going to get some of that guidance that you don't feel like you have at this point. I think one of the things that I had to learn was, uh, um, and I spent a year at Duke Divinity School in their theology, medicine, and culture initiative. And we were taught not to call ourselves providers, and to think about that. Because we're so much more than a technician. We're so much more than, if our patient wants it, it's legal and technologically available, we have to do it. But we don't leave who we are at the door when we walk into a room. We're not robots going in there. We're coming in with some medical expertise. But, if you're my patient, Alex, you have your lived experiences and you know your body better than I do. So we're collaborating together. And I think that's the beauty of when you really have relationships and you're journeying and accompanying your patients. And so I'm hopeful that more and more students, as they approach the clinical years, will really feel comfortable in being who they are with patients. And if that includes a life affirming Hippocratic approach, which we at Outplug believe, that you're put in a position that you don't have to opt out of things, because the narrative isn't such that the expectation is that you're supposed to do it. Because as you've alluded to, it's not medicine, but it's very difficult to do when you know that there are consequences. So as we wrap up, I first want to say thank you so much for your time, and wish you all the best as you start your second year. But I want you to speak to the other medical students that are out there. I want you to talk about, if you could have your medical school experience to look different than what it is. uh, I want you to speak to the students on how to be courageous, but also speak to the medical students out there. Like, as a student, what kind of education do you want on all kinds of topics, whether it's heart disease or it's abortion?
Yeah, I think to the students out there who may be uh, scared or may just be shy about expressing their opinions, whatever the opinion may be. I think it's so important for us in medicine to have good dialogue. And I think that if we don't have that dialogue, we're going to lose that that moral side of us, that moral side of us that makes us human. And at the end of the day, as the AI world or whatever you would call it starts to emerge, what makes us different than those AI than the AI that's starting to emerge in healthcare if we don't have that reasoning, that dialogue, that really human touch to us. And so if we're just agreeing with everything that someone puts up on the screen, what good is that? And I think that it is important for us, especially as we continue to grow in our medical education, to start to challenge things, to start to look at articles and literature that we're being presented with, and see if it's actually legitimate, to see if there is another side of it, and then to speak out against that. Now, it doesn't have to be speaking in front of your entire class or going and confronting a faculty member about, oh, this is wrong, you shared this and this is wrong. It doesn't have to be that big, but even if you're in just a small group of people and you decide, hey, maybe this is the time to ask some questions. And I think that's one of the big things that I've tried to do is, instead of expressing my opinions directly, just asking good questions and asking further questions to get people to think about what they're actually saying and if they actually believe that or not, and to think more deeply. Now, that requires you to really know the topic well, but if you can just ask really good questions and really insightful questions to get someone to really think about their opinion, I think that it may make someone kind of think maybe this isn't right, or maybe there's more to the story. And then for the education side of things, I I think, as I've said before, that I would love to just see a medical education system where we can see both sides of the story. And I think that's important for not just medical education, but for any education in general, and for really anything, politics, whatever the case may be. Let's see both sides of the story so that we as professionals can make our judgment as to what we are going to side with, because we are in a polarized world and these things are very opinionated, but we have brains. We've gotten into medical school. We've done well on all of our tests. We are smart people. We know how to read literature. And so give us those resources, give us both sides of the story, bring in lecturers that have another opinion. Because whenever all of our lecturers in our reproductive block are pro-choice OBGYNs, that's a really one-sided reproduction education. But if we could bring in some other pro-life OBGYNs to teach some of the course and at least show a different side of that, that would balance it out and give you as a future physician the choice and the right to decide what moral stance you're going to take on those topics, whether that be pro-life, pro-choice. I think that just having that balanced education would be so helpful. And I would just love to see that in the future and not just presenting one side, especially if you're getting federal dollars, if you're getting funded from the state. I think you should be very balanced. If you're a private university, you can probably do what you want, but as a public university, you should be balanced. If you're getting money from the federal government, you should be balanced. So that's kind of my big takeaway message from education. Just love to see both sides of the story.
Alex, I'm going to challenge you when you're a faculty member at a medical school or dean of a medical school. We're going to have you back on maybe way before then, but then you can tell us how you made that happen, because that is the root of advancement in research and science, is when we do step back with humility and we put all our cards on the table and sometimes disagree, but we go have a cocktail or a Coke or a beer afterwards,
right.
and we're still friends.
That's
Well,
right.
thank you for joining us and being a leader in your school and in the work that you're doing. And we'll look forward to catching you up with you and hopefully seeing you at MBEC one of these years.
Right. Thank you, Dr. Bane, for this experience, and just hope to continue to help out and help to keep pushing the mission of Applog.
Thanks, Alex.
We hope that you enjoyed today's episode of Observations and that it broadened your perspective on women's health and how we can care for both patients, mother, and preborn child. If you like this episode, make sure to give us a 5-star review where you can find your podcasts. Make sure that you like this on YouTube and subscribe to our channel for more episodes coming up. And if you have any suggestions on any topics that we should cover or guests that we should have on, make sure that you email us at media@applog.org. Again, thank you for joining us for today's observation, and we'll see you in our next episode.